Hello everyone. The topic for today is diseases of periradicular tissues. First, we need to know whenever the toxic product leaves the apical foramen. This is the apical foramen. This given in blue is the perial space, that is periodontal ligament space, and this is the alveolar bone. So the toxic product, that is the microorganisms or the end products of the necrosis of the pulp, these toxic products leaving the apical foramen and invading this space leads to the formation of the periradicular diseases. Before going on to the details of each of the periradicular disease, let's go through the classification. So there is first one, clinical classification of the periradicular diseases, and other one will be histopathologic classification of the periradicular diseases. In the clinical classification of periradicular diseases, we have symptomatic periradicular diseases. That is, in these diseases, the patient will present with symptoms. So, under this, there is primary symptomatic apical periodontitis. Primary symptomatic because the patient will present with symptoms. Apical periodontitis because it is involving the PDL in the apical region of the tooth. Okay, like this is the apical region of the tooth, and the PDL here is involved in this, okay, because the infection is leaving the apical foramen, so the PDL in this vicinity will be affected. So primary symptomatic apical periodontitis, so this was previously known as acute apical periodontitis. Now the term acute has been replaced by symptomatic. The other one is secondary symptomatic apical periodontitis, also known as acute exacerbation of asymptomatic apical periodontitis or phoenix sepsis. And then the third one in the symptomatic category is the symptomatic or acute alveolar abscess. So let's understand what this means, acute exacerbation of the asymptomatic apical periodontitis. See what happens. The primary symptomatic apical periodontitis, if the patient doesn't seek treatment, this will eventually become asymptomatic apical periodontitis or chronic apical periodontitis. In this phase, the body will be in a state of equilibrium. So anything which disturbs the equilibrium will lead to the secondary symptomatic apical periodontitis. First one was the primary symptomatic, then this primary symptomatic phase went to the asymptomatic apical periodontitis. Now in this, the body is in state of equilibrium. Anything which disturbs the equilibrium, it can be microbial byproducts or initiation of the root canal in a tooth. So what will happen after the equilibrium is disturbed? There occurs secondary symptomatic apical periodontitis, and this is nothing but the phoenix sepsis, also known as acute exacerbation of the asymptomatic apical periodontitis. What is phoenix sepsis? It is the acute exacerbation of the asymptomatic apical periodontitis, nothing but the chronic condition turned into acute. So acute exacerbation of the asymptomatic apical periodontitis. Coming on to the asymptomatic periradicular diseases. In this, the first one is asymptomatic apical periodontitis, which was previously known as chronic apical periodontitis. So chronic has now been replaced by asymptomatic. Then the second one is asymptomatic alveolar abscess, previously known as chronic alveolar abscess. And then there is condensing osteitis, that is chronic focal sclerosing osteomyelitis. Then first one was symptomatic periradicular diseases, then asymptomatic periradicular diseases, then the third one is persistent apical periodontitis, fourth one is external root resorption, and the fifth one is diseases of periradicular tissues of the non-endodontic origin. Since these are of non-endodontic origin, therefore the pulp will be vital, hence positive vitality test. Example, dentigerous cyst, OKC, etc. First one was the clinical classification of periradicular diseases. Now comes the histopathology classification of periradicular diseases. So why is histopathology important? Because Grossman states that asymptomatic apical periodontitis, see, in this asymptomatic apical periodontitis, what happens? There is the widening of PDL space, breakage of lamina dura, and also periradicular radiolucency in a chronic phase. there is periradicular radiolucency. So according to Grossman, we cannot differentiate between this asymptomatic apical periodontitis and other diseases of the periradicular tissues unless we do the histopathology. So he gave the histopathology classification of the periradicular diseases as apical granuloma, apical abscess, and apical cyst. See, that is what Grossman says. Now, in the radiology postings, you will actually get to know how to differentiate between a granuloma, abscess, and cyst on a radiograph. In granuloma, the size will be less than 1.6 centimeter. It will be a well-defined and absolute radiolucency. Absolute matlab it will be a clear dark radiolucency which is well-defined and whose size is less than 1.6 centimeter. Then, if the size is more than 1.6 centimeter and it is not so well defined and it is not a clear radiolucency, that is, it has trabeculations in between, then the diagnosis goes to abscess. Then, if the radiolucency is more than 1.6 centimeter, it is a well-defined absolute radiolucency but with sclerotic or radio-opaque border, then the diagnosis goes to the cyst. Okay, granuloma, abscess, and cyst. This is well-defined. This is also well-defined, but it is surrounded by a radio-opaque border. This has a clear radiolucency, that is absolute radiolucency. This is also a clear radiolucency, but in abscess. Beginning with the symptomatic periradicular diseases. First one is the primary symptomatic apical periodontitis. So, by definition, primary symptomatic apical periodontitis is the painful inflammation of the periodontium as a result of trauma, irritation, or infection through the root canal. So, what does this mean? It is the painful inflammation. Periodontitis matlab itis hai to inflammation. So, it is the painful inflammation of what? Periodontium, because periodontitis. So it is the painful inflammation. Why painful? Because symptomatic. Symptomatic या acute, it is matlab it will be painful. So it is a painful inflammation of periodontium as a result of trauma. So inflammation क्यों हो गया? Because of trauma. या तो trauma था, trauma as in occlusal trauma, high filling, irritation or infection through the root canals, or infection which has passed through the apical foramen to the periodontium. Now, regardless of whether the pulp is vital or non-vital, this means that primary symptomatic apical periodontitis can occur in a vital or a non-vital tooth. Vital tooth में कब होगा? When there is occlusal traumatism, और non-vital tooth में कब होगा? As a sequelae to the pulpitis. So, what does this do? This produces clinical symptoms including painful response to biting and percussion. TOP will be positive and there will be pain on biting. So, this is primary symptomatic apical periodontitis. Causes of primary symptomatic apical periodontitis in a vital tooth. As we saw that this can occur in a vital or a non-vital tooth. So the causes of this in a vital tooth can be abnormal occlusal contacts or high filling or wedging of foreign object between the teeth or traumatic blow to the teeth. Now, the cause for this in a non-vital tooth can be a sequel of the pulpal disease, that is diffusion of bacteria from the inflamed pulp through the apical foramen. See, so the cause of primary symptomatic apical periodontitis in a non-vital tooth will be the diffusion of the bacteria through the apical foramen. Primary symptomatic apical periodontitis can occur in a vital tooth, non-vital tooth, or during the course of root canal treatment. So, the iatrogenic causes for primary symptomatic apical periodontitis include forcing the debris through the apical foramen, perforation of the root, forcing of the irrigants or intracanal medicaments to the periapical tissues, or overfilling the root canals, that is the GP beyond the apex, will irritate the periradicular tissues and result in the primary symptomatic apical periodontitis. See, if you can appreciate, this is a root canal treated tooth and this radio opacity is nothing but the obturating material, that is GP, and this GP has extended beyond the apical foramen. Now, what are the signs and symptoms of primary symptomatic apical periodontitis? First is the pain and tenderness of the tooth. TOP will be positive. So, remember the TOP, whenever the TOP is positive, it does not necessarily mean that the pulp is non-vital, because we saw that primary symptomatic apical periodontitis can also occur in a vital tooth because of occlusal traumatism or high filling or wedging of the foreign objects in between the teeth. Also, the tooth can be slightly extruded in its socket. There can be pain on biting. So, remember, in primary symptomatic apical periodontitis, there is pain on biting, while as in cracked tooth syndrome or crown originating fracture, there is pain on release of biting. So, what are the symptoms of primary symptomatic apical periodontitis? Pain and tenderness of the tooth, TOP positive, slightly extruded tooth in the socket, pain on biting. The radiographic changes depend on if the tooth is vital or non-vital. This is the vital tooth. There are no periradicular changes because this is a vital tooth. Now, in a non-vital tooth, there can be the widening of the pedial space and slight breakage of the lamina dura. This is the lamina dura, and there is slight breakage of the lamina dura, but no periradicular radiolucency in acute cases. Coming on to the differential diagnosis of primary symptomatic apical periodontitis, first comes the secondary symptomatic apical periodontitis, which we saw is also known as phoenix abscess. We saw that phoenix abscess is nothing but the chronic condition which is turned into the acute condition. Okay, so if because this is a chronic condition, there will be a periradicular radiolucency in secondary symptomatic apical periodontitis. So in primary symptomatic apical periodontitis, there was the widening of pedial space and breakage of lamina dura, but no periradicular radiolucency. But in the secondary symptomatic apical periodontitis, that is the phoenix abscess, there will also be a periradicular radiolucency. The second differential diagnosis is the symptomatic apical abscess or acute apical abscess. In this, the radiographic features are similar to that of primary symptomatic apical periodontitis, that is widened pedial space, breakage of lamina dura, and no periradicular radiolucency. But the clinical symptoms, that is extreme pain and swelling, help us to differentiate between the symptomatic apical abscess and the primary symptomatic apical periodontitis. Remember that in acute cases, there is no periradicular radiolucency because it takes about 6 weeks for the bone loss and demineralization to take place for development of radiolucency. Therefore, in chronic cases, we can see the periradicular radiolucency along with the widening of the pedial space and breakage of lamina dura, while as in acute cases, we can only see the widening of pedial space, breakage of lamina dura, but no periradicular radiolucency. The treatment of primary symptomatic apical periodontitis involves determining the cause and relieving the symptoms. So, we need to first know if the cause is occlusal traumatism, if the cause is a high filling, or if it is due to the infection spreading through the root canal. So, we need to determine the cause and treat the tooth accordingly. For example, if it is due to the occlusal traumatism, we need to do the selective grinding. So, it is particularly important to determine whether apical periodontitis is associated with the vital or a pulpless tooth, and we can determine the treatment plan. Adjustment of high points in hyperocclusion cases and removal of irritants in case of non-vital infected pulp is the immediate line of management. Removal of irritants in case of non-vital infected pulp, matlab RCT. When the acute phase has subsided, the tooth is treated by conservative means. Another symptomatic periradicular disease is the secondary symptomatic apical periodontitis, also known as acute exacerbation of asymptomatic apical periodontitis or phoenix abscess. So, what is it? By definition, this condition is an acute inflammatory reaction superimposed on an existing asymptomatic apical periodontitis. So, we saw primary symptomatic apical periodontitis. TOP will be positive, and radiographically there will be the widening of pedial space at the apical region and breakage of the lamina dura. Now, if the patient doesn't seek any treatment, this primary symptomatic apical periodontitis will become asymptomatic apical periodontitis. That is, there will be no pain associated with these asymptomatic apical periodontitis cases or any chronic lesion. It is in a state of equilibrium and dormant, that is inactive. Therefore, TOP is negative, there is no pain, but radiographically these changes can be seen. So, how are these asymptomatic cases diagnosed? These are diagnosed on a routine radiographic examination. In which we see a symptomless tooth, is having a periradicular radiolucency along with the breakage of lamina dura and widening of the pedial space. So if we see this periradicular radiolucency in an asymptomatic tooth, that means the tooth is having asymptomatic apical periodontitis. Okay, so after we diagnose that this is the case of asymptomatic apical periodontitis, what will we do? We will ask the patient to get this tooth treated. We'll ask him to go for RCT. The initiation of a root canal in this asymptomatic tooth can sometimes disturb the equilibrium because of the root canal instrumentation triggering inflammatory reaction. So this asymptomatic case can become symptomatic. That is, the tooth which was earlier TOP negative becomes TOP positive after the initiation of the root canal treatment, and the radiographic changes will be same as for the asymptomatic apical periodontitis. That is, there will be a periradicular radiolucency. So these cases in which the asymptomatic tooth becomes symptomatic due to endodontic treatment, these are known as endodontic flare-ups. This asymptomatic tooth has become a symptomatic tooth. This is known as secondary symptomatic cause for phoenix abscess. When chronic periradicular diseases such as asymptomatic apical periodontitis are in a state of equilibrium, the periradicular tissues are asymptomatic. Sometimes noxious stimuli from diseased pulp can cause acute inflammatory response in these dormant lesions. We already saw these chronic periradicular diseases are in a state of equilibrium, are asymptomatic, and are in a dormant state, that is inactive. So anything which disturbs the equilibrium will lead to the development of phoenix abscess. So what disturbs this equilibrium? First one is the lowering of body's defense due to influx of bacterial toxins from root canal may lead to acute inflammatory response. So there was a state of equilibrium. Now because of the influx of the bacterial toxins, there is the lowering of body's defense, and therefore which leads to the acute inflammatory response, okay, in a chronic lesion. Another reason is the irritation during root canal instrumentation. Okay, irritation during root canal instrumentation may also trigger acute inflammatory response in a previously asymptomatic tooth. So what are the symptoms of phoenix abscess? The tooth may be tender to palpation, may get elevated from its socket, and may become sensitive, okay? And the mucosa over the radicular area may appear red and swollen and is sensitive to palpation. So symptoms in the tooth: tender to palpation, elevated from socket, TOP positive, and mucosa may appear red and swollen. Okay, so we saw that in asymptomatic apical periodontitis there is a periradicular radiolucency and TOP was negative, but in secondary symptomatic apical periodontitis there is a periradicular radiolucency and also the TOP is positive. Now coming on to the diagnosis. The exacerbation of chronic lesion is most commonly associated with initiation of root canal therapy in a completely asymptomatic tooth with well-defined periradicular lesion, which we saw this was an asymptomatic tooth and there was a periradicular radiolucency. Now, after initiation of the root canal treatment, the tooth becomes symptomatic or TOP becomes positive. So, this condition where we see that the asymptomatic tooth has become a symptomatic tooth because of the initiation of the root canal therapy, this is an indication of the development of the phoenix abscess. Also, the patient can give us the history of trauma. In trauma cases, follow-up is important to assess the pulp vitality, because just after the trauma, the pulp can be vital, but after some time, the pulp becomes non-vital. So we need to keep the patient on follow-up. Now, we need to remember that lack of response to the vitality test diagnoses a necrotic pulp. Okay, see, for example, in EPT, if there is an early response in an EPT, that means there is a inflammation of the pulp. Now, if there is a delayed response, that means the pulp is degenerating. However, if there is no response shown by the tooth in EPT, that means the pulp has become necrotic. However, on rare occasions, a tooth can respond to EPT because of the fluid in the root canal or in a multi-root. This is a false positive response. What we need to remember is that in phoenix abscess, the pulp has become necrotic. Therefore, there will be no response to the EPT. There should be no response to the EPT or other vitality test. Coming on to the differential diagnosis. First one is the symptomatic or acute alveolar abscess. Remember, since this is acute, therefore there will be no periradicular radiolucency. But in phoenix abscess, there is a periradicular radiolucency. Symptoms of these will be same. Because the treatment of both lesions, that is acute alveolar abscess and phoenix abscess, is the same, no differential diagnosis is needed. So first one is the symptomatic alveolar abscess. Second differential diagnosis is the painful pulpitis. In cases of pulpitis, pulp vitality test will show some response, but in case of phoenix abscess, since the pulp has become necrotic, there will be lack of response to the vitality test, that is EPT or thermal test. Secondary symptomatic apical periodontitis is an acute symptomatic abscess with distinct periradicular changes, which we already saw. It can be differentiated from symptomatic apical abscess, in which widening of the PDL space is the only radiographic change. This is the symptomatic or acute alveolar abscess, and we know that in acute cases, only widening of PDL space or breakage of lamina dura can be seen, but no periradicular radiolucency is seen in cases of acute cases. The treatment for phoenix sepsis is same as that for symptomatic apical abscess. That is, we need to establish the drainage. And so this procedure is given in detail in the chapter of endodontic emergencies. In the next video, I'll be discussing about symptomatic or acute apical abscess.